ahead and start it.
Okay.
Because yeah, I think it's genuinely gonna be fine, and I'll explain about functional family therapy too. Great. So hi, Alex. My name is Myers. Nice to meet you.
Nice to meet you.
Thank you so much for coming in today.
Yeah.
I just sort of wanted to take a minute, because I know this is our first session, just to talk about like maybe what functional family therapy is, if you maybe have any idea what that is, if we could just talk a little bit about what that modality is before we jump in. Have you ever heard of functional family therapy before?
Not really, no.
Yeah, so is it okay if I explain to you a little bit about how that works?
Sure.
Perfect. So functional family therapy is really just about this idea that I know today you and I are just meeting, you and I, and then next week I'll meet with your parents. And then moving forward, we would probably meet maybe 8 to 12 times, so it's not too long, it's just a couple months of sessions. And basically we'll be working as a family, the whole family system as we call it, to just make sure that everyone can articulate their goals, can get on the same page, and then we can just sort of alleviate any tensions or problems that you might be feeling as a family.
Okay.
Yeah, so it's, I guess the sort of point of view that we try to take is that like it's no one's fault that we're here. You know, it's not something that you did or something that your parents did. We just want to work together as a family team to sort of make things right, make things better.
Mm-hmm.
So perfect. So let me know if there are any questions about that as things arise. But today is just going to be about you and me, and really just about you, and I guess what maybe brought you into therapy in the first place.
Well, I guess I'm here just because like at school, I didn't really do good on a test, so like my parents wanted me to come in.
Okay, you didn't really do good on a test. Could you tell me a little bit more about what that means?
So I'm at this really cool school right now. It's like about like arts and all these things that I really, really like.
Yeah.
And I think acting is really cool.
Awesome.
And that's like something I really want to do.
Do you mind if I just write down a couple of these things, just some of the things you're saying, so I can just take notes and remember, because it's all really important. So
Yeah.
Great. So sorry, you were saying it's really cool, all about acting.
Yeah, and I guess my parents are like, well, basically, I didn't do as good as I wanted on a test, and I got really I don't know, like I guess like they called it a panic attack.
Okay.
But I was just like very like upset about the grade.
You were very upset about the grade,
Yeah.
and it led to this sort of panic attack.
Mm-hmm.
Was that the first time you'd had one of those?
Like that, yeah.
Yeah, that intense.
Mm-hmm.
Yeah, that it sort of felt like you needed to be brought in here.
Mm-hmm.
Well, no, things like that can be really scary. So I can understand if that sort of felt like an overwhelming, almost like out of body experience.
Yeah, it was a lot. I kind of felt like I froze a little bit.
Yeah. So this anxiety that you had about not doing so well on this test, which happens, by the way, you can't always get A's. Where do you feel like that anxiety was coming from?
So I think of myself as a good student. I think
Mm-hmm.
like I usually do well in school. I work really hard. But like my parents want me to change schools.
I see.
And they want me to go to this school that's like, I don't know, they think it's really important, and that then I'll go to like a really fancy, like, I guess the Ivy League college. And like my parents are lawyers, like they're like very important, I guess, in what they do. And I don't know, they want me to change schools. They want me to go to this Ivy League school that's like, that I don't really know anything about. And right now, like, I'm just trying to do good in school. And like I was saying, I think I do good in school usually, but I don't know, like I got a B, and I really thought that wasn't good enough. And like my parents are always like trying to put all this pressure on me, and like trying to get me to do all this stuff that I don't want to do.
Sure.
And I try hard, but it's like it's not good enough, and they're like better, and they need me to be like as good as they are, and that's just like, it just doesn't seem possible when they want me to do all this stuff.
Yeah, no, you said a lot of stuff just now. If I could just take a minute to just slow us down for a second. So yeah, I'm hearing you say that your anxiety is coming from the expectations that your parents have of you to be like, I guess, a straight A student, an Ivy League applicant,
Yeah.
which can feel really intimidating, especially because the little I know about you seems like you're really interested in the arts and theater, and maybe those things. I guess I'm just curious if you feel like your parents think that your academics and your love of the arts can exist simultaneously.
I don't know. I think they want me to do what they do, and I don't really want to do that. And like, I don't think that the arts is something that they think is like as important or like will get me into the Ivy League schools that they want me to apply to.
I got you. So maybe I'm sort of hearing you say along this lines that like maybe they want better, like they want the best from you. Like they're pushing you to do what they think is the best for you. Like they have this noble intention of like, trying to like, by putting all this pressure on you and it sort of makes you feel uncomfortable. I'm just trying to maybe see maybe where they're coming from, this sort of like noble intent of like trying to just help you build this really successful future. Does that feel like maybe what their intention is? Like, I'm just curious what you think their thought process is around this whole thing.
I don't know. I don't really think I've thought about it that way.
Mm-hmm.
I definitely feel like they just want me to do what they want to do and they don't really care what I think. But I guess like maybe they just want me to like be the best. But I think when they want that, it's a lot to ask, and it's not what I want, and they don't think about what I want.
Okay, so that's maybe this. I'm sensing something that might be a theme based on what you're saying, which is what you just said right now, that they are more concerned about what they want and they're less concerned about what you want.
Yeah.
Does that feel right?
Mm-hmm.
Yeah. So I guess as next week I'll meet with your parents, and then moving forward, all four of us will meet as a group. But I guess that's just something I want to bear in mind, this theme, this idea of maybe differences in what's best for Alex, what's best for you.
Mm-hmm.
I guess to sort of switch gears slightly, if you had to sort of name a goal that you had for this whole time in therapy, or even just in general, just a goal that you have for yourself, what's something you'd like to work on in here with me and with your parents?
Well, I know my parents are gonna want me to like, I feel like they'll tell you that I need to like, I don't know, like get rid of my anxiety so I can like focus on school. But I think I just want, if like you said in the beginning something about like all of us working as a team, like
Okay.
right now I don't feel like I work with my parents as a team. I feel like I just like we don't see eye to eye. So I think at the end it would be nice if like my parents would like listen to what I have to say about like what I thought maybe.
Okay. Sure. So like improving listening.
Yeah. And like maybe taking what I think like into consideration, not just what they think.
Sure. So listening to what you're saying, and then also like just giving your opinions like the attention that they deserve.
Mm-hmm. Yeah.
That sounds great. Yeah, that seems like a really like a good goal to have. Absolutely.
Yeah.
You spoke a little bit about this, but I'm wondering if you could say more about if your parents had to articulate a goal. You were saying something about like getting rid of your anxiety, which it's a little bit more of a complicated process. But I'm just like, what else? What goals do you think that they have for you and for themselves out of this whole process?
I guess like when I said getting rid of my anxiety, I think of like just because they're always talking about like the Ivy League schools and the schools I need to, or like the new high school they want me to go to so that I can get into these Ivy League schools. Like, I think that they want me to not have anxiety so I can focus on doing well in school.
Right.
And I think that they see like that panic attack I had as like getting in the way of me like doing what they want me to do, or like meeting like the goal that they set.
Sure. And the goal that they set is just for you to get into an Ivy League school and be on this fast track to success as they define it.
Yeah.
Yeah, no, all this is great. I'm wondering if we could just to sort of like see where we are on time. I think we're at 10 minutes.
Yeah.
I think we're at 10 minutes, yeah. So thank you so much for coming in today, Alex.
Yeah.
I really appreciate it. I look forward to working with you. I think that we'll be able to sort of try to work towards these goals collaboratively. So thank you so much.
Yeah, thank you for listening.
Of course. All right.